to NMP Talk Show, where we delve into the depths of mental health wellness with compassion, understanding, and expertise. Our goal is to provide a safe space for open conversations about mental health, destigmatize the issues surrounding it, and offer insights and resources to support your journey towards a healthier mind and soul.
Good evening, ladies and gentlemen, and welcome to NMP Talk Show. And today we're going to delve into a crucial topic that affects millions of people, especially women worldwide. And we're talking about cervical cancer. And today we're honored that we have a special guest that has come and join us, a distinguished guest, which is Dr. Reis Itesa. And if you've been following up with our show, he has been here already. So this is his second comeback. So we're really excited about that. And Dr. Itesa and we're going to talk about, the prevalent yet preventable disease, which is this cervical cancer. We're going to explore crucial insights, discuss latest advancements, hopefully, and we're also going to talk about diagnosis, treatment, and prevention. So, without further ado, please let's embark on this enlightening journey and deepen our understanding of cervical cancer and empower ourselves with knowledge that can save lives. Please join me in welcoming Dr. Itesa. Dr. Itesa, welcome to NMP Talk Show once again.
Thank you, Neo. Thank you for having me again. And good evening to the viewers and the listeners.
Thank you for coming back to our show. It's always a pleasure to have you, joining us this time. So, Dr. Itesa, before we delve into the topic, I just want to make a disclaimer to all our audience. Here's the disclaimer. All content on this channel is for informational and educational purpose only. It does not substitute professional medical advice or consultation with healthcare professionals. So once we got all of that out of the way, we excited that we're now going to delve into the meat of the bone. Or the meat of what? We're going to have the muscles and the vessels, into the bones to build this thing up. So let's talk about cervical cancer. What is it?
Yeah, cervical cancer, as you said, it is two words. So the first word is cervical, which comes from the word cervix. Cervix is the part of the lower part of the vagina. The upper part of the vagina and the lower part of the uterus or the womb of a female genitalia.
Okay.
So cancer, it's when the cells of the body starts developing in an uncontrollable way. And if not stopped, it can spread out of the scope to the organs that are nearby.
Okay. So basically, if it's something that spreads on its own, it means it can be stopped, eh?
It means it can stop, depending on when do you see your health provider.
Yeah. Because you're a healthcare provider, a doctor, how many times do you encourage patients to have checkups like these ones?
Neo, we will never stop to emphasize on this one. Patients, especially female patients, need to go and get themselves checked.
Yeah.
This to avoid to reach to a level where we can no longer help. This is very important.
Sure. Yeah. I'm one of the kind that, it takes a long time to see a doctor. My wife always forces me to see a doctor, but if it's something that I can sleep over,
that's not good, eh?
I always prefer doing that. Yeah, but like you're saying, we need to check up on it on a regular basis. Right. So, should cervical cancer be a major concern to individuals?
Yeah, it is a major concern to individuals, especially to women.
Mhm.
Men are not spared, but especially to women. Men are said to be carriers. Women are developing the disease. Yeah, so
Really?
yes, so any woman from the age of 21 need to be going through what we call screening program, cervical cancer screening program, where they need to be checked regularly so that if there is something abnormal, it can be picked up early and then interventions can be done.
Well, the first time we spoke about having this show, this topic on the show, um, the only thing that came to my mind is women, because of the word cervix. Men don't have that.
That's a good point, Neo, that you're raising.
Mm.
That's the misconception that we all have,
Yeah.
that it's only women. Yeah, cervical means that part of the body in a woman genitalia,
Mm.
but men also contract HPV, which is a human papilloma virus that would cause the infection,
Mhm.
which can lead to cancer. So men recently have been found to develop penile cancer, anal cancer, depending on their sexual orientation, of course. So we would say nowadays, lately, men are also concerned. They also need to know what HPV means.
Sure. Yeah, this is scary. I mean, it gets worse, the more we talk about it, and also the more you think about it, because you would think as a man you're safe in that regard, but we have to be, careful about the ladies there. But if we can also be carriers of it, and also develop, like you say, penile cancer, that could be something else as well too, to take note of. And then, what is the prevalence of it in South Africa?
Well, in South Africa, roughly we'll say
Mm.
a lot of women are being diagnosed with cervical cancer. And I'll put in terms of percentage, let's say if it's 100% of women, 50% are getting killed by the disease. Actually, more than 50% are getting killed by the disease.
Mm.
Yes. When you compare to the US, the numbers of I'm having close to 11,000 that can be affected in a year,
Mm.
and only 4,000, which is less than 50%. Okay, in South Africa, we're not saying all women are being diagnosed with cervical cancer. No. But for those who've been diagnosed with cervical cancer, more than 50% are dying with cervical cancer. And there are reasons for that.
Sure. And what are those reasons?
The reasons are many. Yeah, the socioeconomic level of people living in a rural area don't have access to the specialized medical service. Some they're facing stigma. They don't want to be stigmatized for having cervical cancer, so they're not coming forward to get help. Some are living in areas where maybe the culture doesn't allow them to choose their own partner, and decision to go to seek for medical help, maybe it's only from older women in the family who decide for them to go and seek for medical help. So there are a lot, and sometimes the medical facilities, medical institutions are far away from where they live. So all of this, and also the educational level, many people don't even know about cervical cancer. If they know about it, it's only few of them, and their awareness program have been available in South Africa, but all of them mostly are in English. And English is not the language maybe they do understand, so they are not getting the information about cervical cancer or HPV.
Just going off the script, you're talking about English. Are there any plans, in the pipeline where medical terms can be translated to different languages, especially indigenous languages in South Africa?
Yeah, that can be done, but not always. Another thing, do we even read? An average person, we don't really read. We can have an announcement posted on the wall. We pass through it,
Yeah.
and we don't just care. We don't read about it.
Blame it on social media. All these statuses, how many status I get on my phone. So you don't have time to listen to each and every status. So all you do is just, swipe, until you're done.
But there are efforts that's been done from the Department of Health to actually increase more awareness so that many people can be, informed. And there are people who are going from house to house to inform people, to let them know about the seriousness of cervical cancer to a woman particularly. So yeah, effort has been made. You can say that, yes.
All right. So to those that have connected on YouTube, Telegram, welcome to NMP Talk Show. We're talking about cervical cancer, and we do have our guest, as we have introduced him, Dr. Reis Itesa. Dr. Reis Itesa has been on the show before, and he's come back again to impart the insightful knowledge that he has on these medical issues. And back to you, Dr. Itesa. You said that women are carriers. No, men are carriers, but women are producers. Is it?
Are developing the disease.
They develop the disease. So basically, this question that I was about to ask you has been answered. That who are more to develop cervical cancer?
Yeah, most women than men.
Yes. Yeah. All right. And then, what measures, maybe signs, signs and symptoms to indicate the presence of cervical cancer?
Yeah, the signs are many. The first one, a woman will see abnormal discharge from the vagina, which could be watery first and then later on become reddish and brownish. And also the woman will experience abnormal vaginal bleeding. Apart from the discharge, you can have vaginal bleeding during intercourse or after intercourse, and the intercourse might be difficult instead of it being a pleasurable occasion. And also after your period, you might also experience bleeding. Another symptoms could be you can have pain in the lower abdomen, and it gives you a feeling of having a fullness in your pelvic area. You feel it full, as if there were something pressing down your womb. Yeah, that also could be one of the symptoms. Yeah, there are a lot of symptoms. When it's advanced, you can have problem with urinating. That means the cancer is spread to the kidney.
Sure.
Yeah, you can have problems like that as well.
Yeah. Okay, ladies and gentlemen, if you're listening, those are the symptoms that you need to be aware of. We saw a hand that was raised on Telegram. Hilda, are you still on it? You can unmute yourself. Welcome to NMP Talk Show.
Thank you, Neil. Thank you to your guest. My question is, this cervical cancer, is it hereditary or anybody can just have it?
Thank you. Thank you, Hilda. A beautiful question. Cervical cancer, we will not say it's hereditary. We will say that anyone can develop cervical cancer as long as you are sexually active. Most people who are sexually active, 99% of people who've been sexually active have been diagnosed with HPV infection. HPV meaning human papilloma virus. So that is the virus that infects the cervix And as times goes by, it makes changes to the cells around the cervix that we call dysplasia, and those cells might develop to malignancy formation, which is cancerous cells as times goes by. But we need to point out that not all HPV causes cancer. Some types of HPV. It's like COVID. We had COVID here. Some COVID were so bad, some were not that bad. So COVID has types, Delta, you've got your Omicron and all that. So HPV also have types. So there are two types that are known to be causing cancer. Yeah, 85% of those types are causing cervical cancer. It's HPV type 16 and HPV type 18. Those are the ones that cause cancer. Now, there's another type, which is type 6 and type 11. Those one doesn't cause cancer, have not been proven to cause cancer, but they cause what? I'm sure we all know about warts. These lesions that you have all, around your genitalia that can be easily confused to a skin tag. Yeah, but when it's around the genitalia, we don't call it skin tag, we call it what? Genital warts. So if you had developed genital warts at a certain stage of your life, it means you've been in contact with HPV type 6 or type 11. Less likely to cause cancer. But type 16 and 18 are the ones that are incriminated with cervical cancer.
Okay. So the type 6 and the type 11, can you get over-the-counter medication for it? Or do you need to see a doctor?
Okay. First, to start, let's avoid going to seek for medication. Let's avoid being infected. Now, it leads us to the question, what to do to prevent. There are screening programs. All women from the age of 21 to 65, in some other countries, can go up to 70 years old, are called to be screened to do what we call pap smear. Women knows about this because they often get it from the clinics or from their healthcare providers. So pap smear, this will help you to be screened and to see whether you've got abnormal cells in the cervix or not. If the result comes back as normal after that pap smear sample being sent to the lab and examined under the microscope, and the result come back to your doctor and said it's normal cells, then you're okay. Then you need to repeat it after 3 years.
Oh, so it's not a yearly thing.
It's not a yearly thing.
Okay.
If it comes back abnormal, then you'll have to repeat it after 6 months or after a year, depending on what your healthcare provider will suggest.
Okay. Hilda, I hope your question has been answered there. If not, you can still raise your hand. Okay, let's get back to you again. Yeah, we're listening.
Oh, no, it's been answered. And coming to the pap smear, ne? You know, I don't know with other women, but sometimes it's so embarrassing to do it. So some of us, we ended up not even wanting to go again. What are the chances of...
Sorry to hear that. Hilda, sorry to hear that. That shouldn't be the case, Hilda, because before you can do any medical procedure, your doctor or your healthcare provider need to take you through counseling, need to explain to you what pap smear is all about. And they need to reassure you that this is, you're going to be offered your privacy to undress, and when you're ready, you're going to be having a gown on top of you, and you're only going to expose the area that need to be examined, in this case, your genitalia. So then your health provider also through counseling will tell you that it's not painful, it's a bit uncomfortable. There's a bit of discomfort, but not painful. And then that's what it's going to do. And it takes few minutes few minutes and it's done. I don't know, Neo. I brought
Yes.
some of the.
Yeah.
I brought some of the tools that we use during pap smear. This is a pap brush that we use through pap smear. For those who never did pap smear, maybe this demonstration can help them to feel at ease. This is how it looks, and this is really not hard to hurt you. It's not hard. You see, I can bend it. It's not hard at all, so it won't hurt you at all. And then we've got a disposable speculum. I'm sure you all know about this. This is a disposable speculum, and this is the device that goes through your vagina. It goes through your vagina just to allow your healthcare provider to see and can extend it so that he can see your cervix. And as soon as he see the cervix, he can see the macroscopic aspect of the cervix, how it looks. And then after that, he can use the brush to go through the opening of your cervix and just collect few samples of the cells that may be done. So he does it on the exocervix and also on the endocervix. So then after collecting, that's when it's going to use this bottle to put the sample inside and send it to the lab. Then you wait for your result. It's not painful. Please don't delay. Do it. And this is even free at the clinic. So there shouldn't be any reason for financial cost that involved in this, because it's a free service at all local clinics.
Okay. Well, I think you answered there. We do have a comment on YouTube. Let's see. Yeah, I'm trying to read the comment there. He says, I saw this guy called Help Me, and yeah, I think he's sending a compliment there. I just can read nicely what he's saying there. Yeah. But anyway, if you still have a question, Hilda, are you covered there?
No, I'm covered.
Awesome. Thank you. So let's propel along. What measures can be taken to prevent cervical cancer?
Yeah, measures, as we mentioned prior, we need to have the screening program.
Yeah.
And every 3 years, for those who've got a history of a cancer or who have been having abnormal result after the lab test, they can do it every year or every 6 months, depending on what the health care provider advised them to do. And practice safe sex as well, because this is very important, because it's through sex that you get HPV. And as you said, 100% of people who are sexually active, 99.5% got HPV. And HPV is the most common STI in the world.
How dangerous it is? Is it?
It's the most common, and it can lead to cancer. That's how dangerous it is.
Yeah.
It's the most common, and if you find yourself with type 16 and 18, that can develop and progress to the cells being changed to cancerous cells.
Wow. Listeners, I hope you're taking notes there. This thing of postponing checkups.
It's not good at all.
Not
Neo,
good, yeah.
I also advise our listeners to have a good diet, because HPV can be dealt with by your immune system. Your immune system can actually confine it and remove it, deal with it, and suppress it. So meaning you need to have a good immune system to fight the virus for you. Generally, after being diagnosed with abnormal cells, not cancerous cells, but abnormal cells, you might, after a year, suppress the virus and check again. Actually, the results come back negative. So immune system, eat healthy. Eat your fruit, eat your vegetables. It's healthy to have a strong immune system to fight for you. Don't smoke, because smoking, try and quit smoke. I know it's not easy, but try as much as you can. Smoking suppress the ability of your immune system to fight for you. It's actually depress your immune system.
Yeah, it's not actually a cool thing, eh? Like a lot of people are perceiving. Like if you smoke, you're a cool guy.
Not any doctor will tell you that smoking is good. A doctor can try and negotiate with you with alcohol consumption, but smoking, the doctor will tell you, please quit.
I was speaking to somebody this weekend, and then he said to me, if I walk in and I find the doctor smoking, I have reservations already, because now if you're a doctor, we're looking at you to promote good health, good habits, and you want to come to me and tell me stop smoking because it deprives your body from, helping itself, and you're smoking. I hope you're not smoking, Dr. Itesa.
No,
But you don't have.
I never smoke a single cigarette in my entire life.
You don't have to answer that one. Hilda, I see you still have your hand on.
Yeah, sorry, doctor, if I'm taking you back. The human papillovirus. Did we say men are the carrier of this papillovirus?
Yes, Hilda, men are the carriers of human papilloma virus, which is HPV. But most women are the one who develop. So the man going to infect you, but the woman will develop the disease. This is why in the country, in South Africa, young girls has been advised to get vaccinated against HPV as young as 9, from 9 years old to 14 years old to 11. Our daughters are going to school and they've been given free vaccine against HIV. Please, parents, don't stop children to get this vaccine. It's saving them for the rest of their lives. If they come across this bad type of virus, HPV, they won't reach to cervical cancer. It's going to be just something that the human body will be dealing with it because they've been vaccinated to it. So that's yes, one of the things. Lately, some men has been diagnosed with penile cancer due to HPV, and some with anal cancer also due to HPV. So yeah, lately men as well have been diagnosed with that, but mostly it's women.
I hear that some of the diseases that we have, for instance, COVID, a lot of funding and time has been dedicated into finding vaccine for COVID. What about cancer?
Yeah, there is no vaccine for cancer, but there is a vaccine to stop the spread of that virus, to make changes in your cells, in your cervical cells. So that vaccine, it's worked quite well. And now I can tell you 99% the vaccine can help you not to have cancer. So it's quite something. It's said if someone can reach to cervical cancer, because there is a vaccine that can stop it from happening. It's really a sad occurrence if that can happen.
So that vaccine only works for cervical cancer, not any type of cancer.
They mostly work for cervical cancer. You've got some vaccine are covering only 2 viruses, and some vaccine are covering 4 viruses. We're not going to quote their names, and they didn't sponsor your show, so we're not quoting their names. Yeah, there's 4 strains of vaccine. There's 2 strains of vaccine as well, and there's now 9 strains of vaccines. That's very good because it's covering a number of strain of that virus, which is good. One thing to also note, you might be in contact with HPV, maybe even from the handle of the door. Someone from the toilet didn't wash his hands and touched himself and touched the handle of the toilet door. And yeah, you come and touch it. If you touch a private part, you can get infected. And some as well might be, maybe you didn't have consensual sex, but you've been raped. You can also develop, you can also be infected with HPV. Some, maybe there's no penetration during the sexual intercourse, but private parts are touching each other. That can also be a way of being transmitted with HPV.
Sure. Okay, let's rewind a little bit about the toilet story. I don't know. Just health department must rescue us from this thing. These doors, they must be standardized. You know, those going into the toilet. You push, right, to come out, but the pushing you have to hold the handle. And some of the toilet, especially public toilets, when you're inside, you have to pull to go in. How about they say it must be standardized? When you come into the bathroom, you pull, but when you come out of it, you push. So you don't even have to hold the handle.
Well,
Because you wash your hands, and then you have to now you hold the handle to open for yourself. I mean, it defeats the purpose.
That's a good point, Neo. But yeah, we are where we are today. Yeah, but it doesn't mean if you get infected with HPV, it means you're going to develop cancer. You know, only few percentage, 15 to 20% only might develop cervical cancer. So some will have the virus being defeated by your immune system. So let not panic. This is just a way of you getting to know about the condition, so that you can take precautions. So good hygiene, very important. This was not only because of COVID, but because of, you know, the way we live our life. We need to keep those habits going forward.
Yeah. No, I agree with you there. And thanks for those that I have just joined the show on Telegram. We're talking about cervical cancer. We spoke about how we can see the symptoms, you know, to indicate the presence of a cervical cancer. We also spoke about the risk of developing cervical cancer. And one of the things that was particularly mentioned here is that men are carriers of HPV, and the woman then will, I can't forget the name.
Will develop the disease.
Will develop the
but
disease.
Then, if, let's say, let not always blame men. If that man,
Adam,
if that man X carried the disease to a woman Y, then they broke up. The woman stayed with the infection. Now the woman meets another man Z, who does not been infected, who never been infected with HPV. So the woman will be the one infecting the man. So
it's a
I
chain
don't know
effect.
if it's a chain effect. Yes. So
Okay.
yeah.
Hopefully we stick to one partner.
Yeah, because you find couple now starting fighting at home because it's when you're the one who brought the disease. That's why I've been diagnosed. No, it could be vice versa as well. Yeah, so it's all depends.
Yeah. Okay. No, thank you for clarifying that, Dr. Itesa. All right. So, what measures can be taken to prevent cancer, cervical cancer?
Yeah, I think Neo, we answered that.
We answered that. Eh?
Yes, we answered that. It's your screen.
The screening.
It's your safe sex practice.
Yes. Yeah.
And going to follow-ups, your medical follow-ups to your healthcare provider, and avoid promiscuous sexual not having multiple sexual partners, and not trying not to date high risk partners. You know what I mean? High risk.
What a high risk.
A high risk is someone who's promiscuous.
Okay.
A high risk could be is someone who's a sex worker. It's a high risk. A high risk could be someone who take any opportunity to indulge in a sexual activity.
Yeah.
That could be also a high risk.
So promiscuity,
not
we
a
must,
good thing.
yeah, we must avoid. So what are the steps that women can take to reduce their risk then?
Yeah, then you go see your doctor, you get screened, and the results come back. Your doctor will explain to you what the results are. There are a few types of results. I don't know if you allowed me to mention them.
Yes, please. Go ahead.
You can have what you call ASCUS. When your pap smear results can come back, result ASCUS. ASCUS meaning atypical squamous cell of undetermined significance. Here, the pathologist at the lab just found that your cells are not normal. They're starting to become abnormal. Then he might, this could be due to a vaginal infection, it could be an inflammation, a cervicitis, this could be anything. So your healthcare provider might ask you to come back and do this again after 6 months to see whether your immune system dealt with it. As usually this would happen. Within a year or two, it's going to disappear. If it's still there, then probably your healthcare provider will ask you then to do HPV serology. So they're going to find out whether you've got antibodies of HPV in your body. So it means that you've been in contact with HPV. Then they can now check further to see whether which type of HPV do you have. Is it the 16 and 18, the dangerous one? Or is it the 6 and 11 one, which is not dangerous? You just not going to develop anything around cancer. So after that, then you come back in 6 months, it's been checked, or in a year, it could probably become normal again. Or if it still persists, it could maybe differentiate, the cells could be differentiate now or progress to become, the result will now be low squamous, what we call LLS, L-cell, which is a low-grade squamous epithelial cell, yes. And after that, if still continue progressing, it becomes now high-grade squamous intraepithelial lesions. So then you're still not having cancer. It's a pre-cancer stage. You're still not having cancer, but you've got abnormal cells. So nothing to worry about. Your doctor now might now check and see with another specialized exam that we call LEAP, which is a large loop electro excision procedure. So he's going to use microscope, zoom into your cervix, and put some chemicals there called acetic acid that will help him to see whether your cells are normal or they're abnormal. So that acetic acid will help to color the abnormal cells. Then if there are many, then he's going to cut them, to chop them, to remove them so that they don't progress further.
Okay.
And that could be it. That could be end of story, and you're fine again.
So that vaccine that we're talking about, wouldn't that help at that point?
At that point, remember, you didn't get vaccine for you to develop that. And at that point, because not all women in South Africa got vaccine. This started only in 2014 with schoolgirls.
Oh.
in 2014. Prior to that, there were no vaccine. So the female learners in schools are better protected than nowadays than the
older
ones.
generation.
Yes.
So if it's administered at school levels, I presume that will be free, right?
It is free. It is free. But even those who didn't get the opportunity to have that, they can go and consult their private or their healthcare provider. They can have that vaccine, and you need to get it from 0 day up to 1 month and then 6 months. It's 3 doses of
3 shots of it.
Yes, 3 doses of that vaccine. And then you are protected from HPV infection and therefore from developing cervical cancer.
Okay. All right. So there's no loss there, at least.
No, there's no.
Because I was worried about the older generation. If it only started 2014 with the school girls, I mean, those who had left school already a long time ago at risk, but they can have it.
They can have it.
All right.
They can have it.
So from any hospital, any surgeon.
Yeah, from any healthcare provider, you can have it. Your doctor will prescribe it for you, and you go buy it by the pharmacy, and then you come back and inject it. Give you the injection, and you are protected.
Yeah, I guess the next question that I was about to ask has been answered.
No problem.
Which is the treatments that are available.
Yeah, the treatment that are available actually. Vaccine, it helps you to not reach the cancer level, the cancer stage.
Yeah.
But what if you are on a cancer stage? Then you'll need to go through chemotherapy and radiation, depending on how far the cancer is spread. If you are at the early stage, it's only limited to the vagina or to the cervix. And the next stage, which could be stage 2, could be now be spreading to your vagina. And then later on, the next stage could be now to your ovaries. Yes, to your womb. And then the doctors will decide maybe they can do hysterectomy, which is removing your uterus, your womb, so that the cancer doesn't spread to your kidney, so that the cancer doesn't spread to other organs that can be around.
I hope you all listening. I see we have a whole number of guests, audience that have connected. And if you do have a question, please don't hesitate. Ask the question, or you can even comment on what you just heard. And those that are connected on YouTube as well, hopefully you're getting the message from there, and you can type your question, and then we'll be able to read it out to the doctor here. Now, doctor, we've spoken about the symptoms. We've spoken about the diagnosis. We've spoken about steps of preventing that, and which some of them is having a regular checkup. You've spoken about pap smear, how important that is, and even one of our guests has mentioned. I think she's echoing what all the women are feeling about pap smear. That it's like a humiliation of one's.
Yeah, please don't feel like that, because that's actually the starting point of you avoiding reaching cervical cancer. So you need to go through that, and it's not painful. There's a bit of discomfort and doesn't last. It's only just few seconds of having that pap brush going through your cervix, and usually we turn it away like this, and that's it. That's it, few seconds. So it shouldn't be painful, and please don't feel bad about it. There's no stigma at all, and it's private. It's between you and your doctor. It's not painful. So please, we encourage you to go through that so that we can know where we are. Do we have abnormal cells or we don't have abnormal cells? If we do, there are things to be done so that we can stop it to reach the level of cancer.
Yeah. Just to let you know, this will be a 2-session episode. Today we're talking about cervical cancer, and the next episode that we're going to have, we'll be talking about penile cancer, right? And which I'd never thought this could be gravitating towards that, in that when I thought about cervical cancer, it was only limited to women. But since men can also be carriers of it, then they are also in high risk, isn't it?
Yeah, men are also exposed to develop penile cancer or anal cancer. So we shouldn't be regarding women as the only one to develop this disease, though they're the most who are affected. Yes, men it's less, of course. Yes.
Yeah. Right, Doc. We've covered a lot of things on this topic. It's only high level that we've dealt with cervical cancer. But now, how do you now encourage somebody to go for these checkups?
Yeah, I'll encourage everyone. I'll tell them that, look, it's pain-free and it's free of charge. And this is available at all medical care facility, especially in a government level. This is free of charge. So take advantage of it and use it. Why do you have to be dealing with all the stress of children losing their mother because of cervical cancer while it could have been prevented? Why do you have to be going with all the stress of now you starting thinking of doing your last will because the doctor told you that you might die in few months because of the stage of cervical cancer that you have, and this could have been prevented? So we don't want that. We don't want people to reach the stage. The information is available, and the procedure or the screening tests are free of charge, not painful. Make use of it. Take advantage of it.
Yeah. Does it have an adverse effect when you are pregnant?
Well, pregnant women also can be screened as well. In South Africa, we do that before the age of 20 weeks pregnant. It can go up to 24 weeks pregnancy. So you can be screened as well. And this won't affect your pregnancy at all.
Is it infectious though?
It's like
for the baby. I'm referring to the baby now. That's in your womb.
Yeah. Remember, the baby has to pass through the cervix.
Yeah.
That is the canal. That's the passage.
Yeah.
It's like the door for you to get through the passage, the corridor.
Yeah.
From your room. You need to pass through the door. The cervix is like the door from the womb to the vagina.
Okay.
So the cervix is the one that is sick, that having abnormal cells.
Okay.
So the baby passing through might actually cause more damage. Yes, that's why we want to screen people, and we want to advise people when to fall pregnant and tell them when it's safe to do so. And yeah, everything needs to be monitored with your healthcare provider, and you're gonna get proper advice as to how to handle all this.
All right. So you said they can be screened, right, when they're pregnant. Yeah, let's say they fell pregnant and they maybe 3 months into pregnancy, and then it is determined that they have cervical cancer. What options do they have as a pregnant woman with the baby concerned?
They will be helped to deliver, probably through C-section. Then the baby will not use the cervix passage or the vaginal passage. Through C-section, depending on the stage of the cancer.
Mm.
And afterward, then the woman can go through chemo and radiation as well
Okay.
to deal with treatment.
Yeah, we're still taking, we can still take one question because we're almost running out of time. But we really appreciate that you have connected on the show so that you can learn more about cervical cancer. And what the doctor has mentioned earlier is that a lot of people, especially women, don't they don't go for checkups, you know. And one of the Hilda here also mentioned that it is because of feeling embarrassed, you know, invasion that they stopped even doing the pap smear because thinking that they're going to be humiliated like that. But we taking courage from what you're just saying and also your demonstration on how this is done and how quickly it is and the reason why one should have pap smear, for instance, to prevent such cases where if it's not checked, now you have your cervical cancer, whereas it could have been prevented earlier if those checks have been done. But we thank you for that information, Dr. Itesa. We really enjoyed it. And we know that it's going to help a lot of women that are listening to this show. And if you are connecting, please spread the word. This session will be posted on YouTube from Tuesday onwards. Anything from your side, Dr. Tued?
Thank you. Thanks to you for the opportunity, and we thank the listeners for their overwhelming support. We can see how many there are,
Yeah.
and how they supported this show, and that actually shows that they are very keen to know. They are very much interested, and this is where it starts, because after this, many of them will go for screening, and many of them will avoid to reach the stage of cancer.
Yeah. Yeah. Right. We thank you so much for joining our show. And I also have my own closing remarks as usual. So, as we come to the end of tonight's enlightening discussion on cervical cancer, I extend my heartfelt gratitude to you, Dr. Reis Itesa, for sharing this invaluable expertise and insight with us. And the information and awareness that you raised today can truly make a difference in fighting against this disease. Remember, knowledge is power, and early detection through screening and vaccination is key to prevent cervical cancer. Let's continue to spread awareness, support each other, and prioritize our health. Thank you for tuning in, and remember, together we can make a difference. If you tell somebody and share this information, you can help save a life. So thank you for tuning in to Neo Morapedi NMP Talk Show. And my name is Neo Morapedi, and this is how we sign it out.